strategic planning.
As long as it works for you, that's all I'm saying.
Right.
Zoom I've been on since then.
Well, it's very nice to meet you.
But he's still in the army until February-ish.
Yeah.
So his girlfriend's gonna have this puppet
That's.
alone for like the first 2 months.
Like,
Very technical.
Oh, her background is in ag. I mean, she works down at Stutzman's. No, not better. But I mean, fortunately, she can run home for lunch, let the dog out, that kind of thing. But
stuff like that, but nothing that's good, like the. No, I don't.
hard, like
Every time they want to go bathroom, good.
but not a hunter. I don't know. Just I think he was born that way. But I can just tell when he was a puppy. Personally, I was always a little concerned early on that I even tried to ease him into it, like when he was a pup, like shoot a 22, that kind of thing. But even then, just his reaction was not.
Meetings of the Johnson County Board of Supervisors are open to the public and are generally live streamed. To join electronically, please visit fit.ly/JOCO meeting. Written comments may be submitted to soups@johnsoncountyiowa.gov. If you require accommodation to participate, please contact the BARD office on 319-356-6000 prior to the meeting. Public comment is at the discretion of the chair. Comments should be limited to 3 minutes. Due to public meeting law, the board may only discuss or act on matters presented on this agenda. Welcome. We'll come to order. It is 3:30 p.m. Today is Thursday, November 13th, 2025. This is a meeting of the Johnson County Criminal Justice Coordinating Committee. I will note for the minutes that Supervisor Fixmo Rise is absent. Do we have any public comment this afternoon? Any public comment? Any public comment? Seeing none, we'll move on to CJCC business. Community Partner Programming. Item 1 is the Scott County Sheriff's Inmate Programming Department. Do we have anyone from Scott County here?
Able to speak. Is it Anton?
Anton, yes.
Let me check something real quick. Let's see, you're gonna need someone to drive the presentation or share screen from there.
I don't know. Anton, can you hear us? I think you jinxed us.
Test.
We can hear you, JJ. Can folks online hear us?
Yes.
Okay.
I can confirm Zoom's working both
Okay.
ways. So.
All right. Well, while Anton takes we still can't hear you, Anton. Well, we're just gonna reorder the agenda a little bit. We'll come back to Scott County in a bit. Hopefully we can get the tech issue resolved. So we're gonna skip down to Community and Family Resources. Good afternoon, Kayla.
Hi, am I supposed to stand up or something? You guys tell me. We'll keep it informal. So I'm Kayla Borja Frost. I'm the clinical director over at the Iowa City Community and Family Resources. Of course, we're also part of a larger organization that has services in Fort Dodge, Ames, Des Moines. But here in Iowa City, we have already been involved working with Johnson County Jail and providing Zoom substance use American Society of Addiction Medicine evaluations on a pretty regular basis. And then that has helped with getting people connected to outpatient for when they leave, when they're back in the community, or sometimes being able to get people into residential directly from the jail setting. And so I think we could expand that. At baseline, we can continue doing what we've been doing. If we were able to have access to a small office space on a regular basis, we could see about getting that space licensed by HHS for us to do in-person evaluations there. And then we could also maybe provide more continuous follow-up in terms of making referrals, connecting people with those services, either with CFR or an organization of their preference for when they leave. So I would see our role as kind of continuing to do what we're doing, maybe expand a little bit, and we're really bridging over into the community so that people will have things set up for when they leave. And that's really all I came prepared to talk about today. I'm happy to answer any questions or
Kayla, what do you
brainstorm more.
what do you mean by space licensed by HHS? Tell me what that means.
For us to come and do the evaluations in person, we would have to have HHS's approval to do them in that space. Because we would probably be asking for IPN grant funds to pay for those evaluations.
Is that something we would need to lead the charge on with HHS or what?
We could take care of it. And we would need to work together and just, things like we would need like different fire safety certificates and like all the silly little ducks in the row. But we have an operations director in CFR that would tell us exactly what we needed to do to get that licensing.
Okay.
And my understanding is that there was a time when that was happening, with Prelude coming in person. So they must have, it's not a new thing. It must have been.
I was going to ask about that, Sheriff. Could you talk about the way that it used to work with Prelude and why that had to stop?
I'll defer to Captain Good. He would have been, that's before my time as sheriff.
I think the reason why it's stopping is because new management came in, it's kind of transferred over.
But it was every morning.
It was
Every morning, yeah. And go ahead and do the OWI cases and stuff. Those substance abuse evaluations done.
From the court side, we loved it. Because before someone got arrested for, let's say, an OWI, the night before would get released from jail, they'd already have the evaluation. And that's probably the number one cause of delay for cases right now is we don't, We order them to get it within 30 days. They don't comply. The code says we're supposed to give them a 20-day contempt sentence. We don't do that because of a housing issue, and it seems counterproductive. But just today, I mean, this morning I had 13 sentencings for evaluations. 6 people had them, and I reset the others. So, if we could get that process done, I think it would save a lot of.
You talk about something that has an impact on our daily population, that's.
Not to get too much into the weeds, because we could explore more how to figure this out, but there may be an issue with the OWI ones because the IPN grant will not pay for those any longer. So people would have to be able to pay, or we would have to find a funding source to pay for those
We
events.
were paying.
How much are they?
The county was paying.
The county was paying for them.
Okay.
We just couldn't do it because there was no.
I think it's $135.
So can you tell me, are you able to do more of these if you're on site? As opposed to, like you're doing it via video now, right?
We're doing them on Zoom now. Yeah.
So,
Either way, I feel like we could up the volume. I can look at my staffing and how we could increase volume, whether it was virtual or in person.
so you're not able to do more in person. I mean,
Right now, we're not able to do them in person. We would have to have the license.
You can't do more than you can on Zoom, correct? So like if this didn't happen,
Mhm.
like you can get HHS approval, or whatever.
We could do
You
more
could still
Zoom
continue
evaluations.
them, but it's a staff.
Well, we do them whenever we get the referrals. We've been getting them done like within the same week.
All right.
Yeah.
So, well, I guess my question goes back to, when you were saying that you liked, they were every day, you had the, in hand what you needed to do to proceed and it didn't delay things. So if you can't do more on Zoom or in person, then why can't you do that volumes that happen? You're like, why can't you do it every day? Or are you doing it every day currently?
We're not doing evaluations with the jail every day.
Okay.
No.
But you would if you could do it in person. Is that what I heard?
No.
Okay.
I'm confused.
That's
about
what
I'm
just trying
I'm
to
saying
figure out why
we
it's an
could,
advantage.
we can, and
to it.
we could increase our volume, and I think we would be able to do that now, even with the Zoom. If we got more requests, I feel like we could do them. Every day, I would have to look at staffing to do them every day for sure, because that would add a lot.
And that's what occurred previously, is a staffing issue, like especially on the weekends. The Saturday, Sunday was just that staffing, holding that staffing levels up. So.
Right, like we're talking about potentially hiring a whole other person if it's going to be an everyday thing, and I would have to look at funding for that.
Those need to be in a confidential or private type setting if you're doing. So that's the other capacity problem we have on our end is to facilitate that Zoom interaction, because we can't do it in the courtroom because court is still going on. So we still need some sort of a space then to accommodate Zoom substance abuse evaluations.
The impression was it was a cost-effective way of lowering our numbers. We just couldn't do it because of the space issues, and that, as much as anything, just killed it. If we can go back to it and save beds, that's all good.
It might in the long run, especially the occasion where somebody does get a contempt, they actually do get found in contempt and they have a jail sentence to serve all because of that evaluation. But if we could get it out of the way on the front end, Judge, I'm sure it'd be a lot easier for everybody.
Yeah, the amount of, I think, court time we spend with court administration scheduling on the judge, the prosecutor, the defense attorney all being there. And then for the person to come in and be like, nope, I didn't get it yet.
And the pay is the big issue, really, because that was just in the Des Moines Register. Anybody see that 2 weeks ago, Polk County having a big issue with payment for substance abuse evaluation. So as long as we have that squared away up front.
We also have like a referral system as well. Like we would give like a ticket, go down to Prelude, and the county would do it.
My recollection was back when we did it in the jail, this was kind of before everyone was up to speed on Zoom. This was pre-COVID. COVID had kind of taught everyone how to use Zoom, and we didn't have it at that point. You guys, that's my recollection.
Rod, do you recall what that expense was?
I just remember that, the folks from the county attorney's office had come in and done the math in front of the supervisors to show that it was a
Net savings.
net savings to do them every morning. Yeah.
I will say also that we do have same day evaluations at our office every day, and they are not full. I know clients tell you guys that they are, but they're not.
I think the problem was that there was a huge disconnect between people when they said, you can just go over and do this today, and they said, okay, and they walked out the door, but then they never made that trip.
They're not
Yeah.
making it over there,
Well,
but
and they were
it
doing
is
it
available
too.
every day.
I would say we average 2 to 3 evals a day for the unemployed.
So I'd certainly, if with a new facility, I'd love to see us revisit whether or not that is in fact doable, because it sure seemed to work well.
3 a day at 130 works out to a little over 140,000 a year. So how were you capturing the net savings?
Well, my impression was that, and Judge, you can correct me if I'm wrong, but I thought there were people that were spending extra nights because they weren't going to be released until they had.
That doesn't sound familiar to me, but
Okay.
I think that savings would just be the jail bed days. I mean, as the judge referred to, it's probably a 20-day temp sentence.
Yeah.
And that just kind of, if you multiply that out by, 2 per day.
But we're doing a lot more in-home detention now too, and that would easily be one that we would turn around and just put out on GPS anyway for house arrest.
And Zoom wasn't a thing back then either, so maybe that's part of it too.
My idea of the net savings, from our perspective, is not just what it's going to save the county, but probably the state as a whole. We will globally, because how many hearings we have and reset and continue. These are all state employees that are just spending inordinate amounts of time when we're not really accomplishing anything. Myself and Judge Burns, every Thursday morning, one of us schedules 4 hours just for these. And so, I mean, we're spending, 4 hours a week, judge time, prosecutor time, defense attorney time, court administration time, court time, sometimes deputy time.
Or if they're getting like FTA or like for show cause hearings, then they're getting arrested again.
So our perspective, I guess, is it's more global with not just the county savings, but also to the state as well. More efficiency. We were talking about our backlog right now, and this is one of the several factors that contribute to our court backlog.
Rob, do you remember how that was handled? Did we just do reimbursement? Was it a contract?
Reimbursement per person.
Kayla, would you be interested in pursuing a reimbursement contract? Would that get you to the point where you would feel that it would be financially viable for you to hire that additional FTE that you mentioned?
Yeah, I think if we could look at everything then, and certainly I'd have to talk to Michelle, my executive director, but if we can look everything over, I could see us doing that, sure.
You'd be interested?
Sure. Yeah, of course.
Oh, one more historical question. Which department was paying for it?
They went through Jan Shaw, I'm fairly certain, so that department's gone.
It's one more to our office.
So we'd have to figure that out.
Is there interest from the supervisors to proceed?
I'd like to at least investigate further.
Brad?
Yeah, definitely.
Okay.
The county attorney's not here, but I think she felt like it was definitely a loss when we weren't able to do as many.
Okay. Well, we will work on that. probably invite you to a board work session at some point to work through the mechanics. All right, so we've made a little bit of progress here. Any additional discussion? Okay, well, thank you, Kayla. Anton, are you with us?
Yes, Jennifer and I are here.
Ah, good afternoon. Welcome.
Hello. Thank you.
Hi, how's it going?
We're doing well. How are you?
I'm good. So you guys want to talk about how we run our programs in the Scott County Jail?
Yeah, briefly, thank you.
Okay. So we rely on our community partners to provide services with our inmates. We have about 85 people coming in to the Scott County Jail to provide services. Some of them are volunteers and others are employees that are employed by our community partners. We provide an orientation and training before they come in, and then they receive an ID badge. We do background checks, of course. And through their training, we ensure that they're providing correct services for our inmates. We decide our program schedule. It's almost like a school schedule. I think Becky may have provided you with an example of our weekly program schedule. Okay. And we look at the risk and needs of the population, and we decide what programs are necessary based off of the research of offender treatment. And then we provide that, or we work with our community partners and our volunteers to provide those services. We rely on our service providers to provide the therapy and counseling groups, and the volunteers come in and do yoga, faith-based groups, values class. Some of this, we call them soft skills for our offender population. With those weekly program schedules, we also provide self-study books for them to request. Those are evidence-based, and we try to provide everything evidence-based. And we also do reentry services, Anton and I overheard you guys talking about your substance abuse evaluations. We actually have free evaluations from the funding from the state mental health state region. I don't know if you guys are in contact with your region to find out what kind of services that you can receive, but I think under our dollars provided, you can receive free substance abuse evaluations in your district. We provide the referrals to the region, given that to Unity Point. Unity Point is a major community partner that we have that provides mental health services and substance abuse evaluations, along with the region, the DAP programming that's available for your region also. We give them the referrals, they come in and they provide the evaluations, and then they post those evaluations with the judge in the county attorney's office on EDMS, and so that everybody is involved. And then they provide reentry services into inpatient, or they can provide just the evaluation that's necessary for the courts. And the other parts of our reentry services, we refer to homeless shelters. We have faith-based organizations that are inpatient. We have Salvation Army Men's Program that's inpatient. And we provide domestic violence, I won't use acronyms, but domestic violence, sexual assault, human trafficking, veteran affairs services. You should have a veteran social justice worker that only works with the courts in your region for veterans that come in that need services also. And they have a lot of funding, which is great. Do you have a question?
Aren't we in the same region?
I think ours is Scott, Muscatine, Clinton, and
Cedar, is it not
Cedar?
Maybe.
We're 7th region. What region are you?
We're in 7.
Yeah, so you should have all those services available under your region, and you should have they call them DAP, D-A-P now. They got rid, when they readjusted the mental health region this last time with the AOS, you should have they call them a DAP coordinator, and I send all my referrals to my DAP coordinator, and then they help us provide those mental health services. But somewhere y'all should have that substance abuse evaluation funding to provide free evaluations and reentry services in your region.
Like the sound of that.
I've been doing this 20 years. I started the Scott County Jail programs from scratch, from the old jail where it was bars and I had one classroom on the 3rd floor to what we have today. So if you have any questions, go ahead and ask.
Questions, folks?
How many classrooms do you have?
Currently, we have that we utilize the most. Our new jail that was built in 2007 was based primarily on providing programming, which kind of irritates operations, if y'all know what I mean. But we have a very large library and we have 3 classrooms. We used to have 4 classrooms, but they took that classroom and made it into an office for space. We have over 50 classes a week that we coordinate, and we supervise the people that come in to do those classes. We don't provide therapy in jail. I know a lot of people get frustrated with that, but I'm not a clinician, but I do. We have 5 clinicians coming in, but therapy is such a clinical therapeutic process that by the time they do an intake and they come in to see the person for a second time, they're released from custody. So that's why we focus on offender treatment, doing group and group counseling.
Can you give us a little context though on Scott County, like size of your community, your average daily population, how many beds you have, and participation?
We have 379 beds. We're direct supervision jail. General population houses 179 men and 78 beds for women, I believe 77 or 76. H unit, male unit is 64 men with 1 officer, which is gone out the wayside. Nobody does direct supervision anymore. Was a 2007 idea that really passed fast in academia and research. And our community, I believe, you're going to step me on the Scott County community. I would have to ask you to Google our population, but we get in, I think, about 8,000 inmates a year, if I recall the last time I talked to my lieutenant. And our average stay to general population, if they make general population, the average stay is 3 to 9 months to a year. I don't really have the numbers for you, which I can get send Becky when I talk to my lieutenant about how the number of people that stay for 1 or 2 days. But we house people out of county. Right now, we're so overfull that we usually have on average about 80 people out of county.
And did you house federal inmates too?
Yes, sir. We're a PREA facility, the Prison Rape Elimination Act. We comply with the federal guidelines and rules on PREA. So that's how one of the reasons why we can house federal inmates.
Okay.
Additional questions?
I do have one more question. You say it's yourself and you have 2 FTEs.
There's 2 of us.
Yep. And you're solely dedicated to like in jail diversion
Correct.
Treatment programming. Okay.
I am not an officer. I am not in the union. I'm not a protected class. I have to say I'm paid more than the officers for what I do. I have a master's degree in criminal justice and a degree in forensic psychology. And so they specifically, I'm specialized in my field, so to speak. I don't want to sound egotistical, but just as a description. But there's our department is specifically our department. We are not operations. We're called support services.
Anything else, folks?
I would just suggest Sheriff maybe getting in touch with Deb Guard and trying to figure out how we can tap into that money that's being discussed.
Yeah, I had a Zoom with somebody from PCA 3 weeks ago, like our District 7 person, so I can reach out to him too.
Excellent.
And the only advice I give you with working with the mental health region, because they're so new, because the AOS or how ASO literally just picked up the mental health funding in Iowa, just like not very few months ago. So they're really running off the seat of their pants and providing services. So I have to really advocate and reach out and ask and ask and ask for services. They're not set up to the point to where they're actively going into the community, letting you know what's going on. Okay, thank
Anything else,
you.
folks?
Oh,
I'm sorry, did you have something else?
no, I said thank you.
Well, thank you. Appreciate your time this afternoon.
Yep. All right, bye-bye.
Bye-bye. All right, and number 3, Crush Recovery Community Center. Rod, welcome.
Thank you. So I think I have a PowerPoint. Somebody's gonna set me up with the laptop. So I got it.
Can you stay there or just over the laptop? Just stay there, I'll bring. Or what's in?
Okay, same. There you go.
I got it.
Give it to me. Sure.
I will say I've spoken to folks that part of why I knew Scott County had so much programming is because I heard from other people that had stayed there, that had gotten things, had gotten certifications and like taken programming. So I do know that that was a place that I was like, oh, let me go see. And then I had sent the information on because other folks had shared how much stuff they were able to do during their stay compared to other jails. So I know from, at least from what I've heard from, you know, some formerly incarcerated folks, that they've really appreciated the level of programming that was there, and we were able to get certain things taken care of before they left. So I'm glad they were able to come. It's impressive how much they're doing.
All right, Rod, welcome.
All right, thank you. So my name is Ron Courtney, and I'm the co-director and co-founder of an organization that right now we're working out of Linn County. We have some overlap into Johnston County, obviously, but then you want to introduce yourself, Deb?
I'm Debbie Courtney, and I'm the other co-founder and co-director at Crush Recovery Community Center.
Yeah, so in a kind of briefly, Crush Recovery Community Center, we started out back in 2017. I'm a retired probation and parole officer, and Cedar Rapids Police came out to corrections and did a presentation on the heroin epidemic and you know, where the trafficking was coming from and things like that. So we're looking for people to start support groups. And it was timely because we just lost our son to a fentanyl-related overdose like 5 months prior to that. So Deb and I thought, you know, it's kind of one of those topics where you want to share with people that have similar experiences. So we started. I mean, I ran 1,000 groups in my 20 years with probation and parole, and so we're going to start our own support group. So I'm a social worker by discipline, so I had these kind of this combination of skills, and we started it. And I was actually working out of the Mission of Hope in Cedar Rapids at the time. My office was downtown, or kind of downtown. And you know, it started out, there was like 2 or 3 people, and there's you know, I had conversations like, well, I really thought there was going to be a need for this type of support in the community because the opioid epidemic was just at full swing at that time. And fentanyl, I mean, it had been around, but it was really starting to make, you know, it's really starting to do more damage on a more regular basis, although it's quite big now. So we're pure lead, and Crush of Iowa was the first recovery community center in the state of Iowa. It's been used across the United States successfully. It's evidence-based, and it's just a place of healing and a place that people, we're a drop-in center. So people come in, right now we're seeing and having contact with about 1,800 people a month. Along lines with along lines with some of the things that we're talking about today. We've been working with the Department of Corrections, the residential correctional facilities up there. We have people come up. We go into the residential correctional facility. Of course, we do all the background checks. These are people with lived experience. So they're all in recovery and they're all trained. They're all trained as peer recovery coaches. Right now, we're getting trained as peer recovery specialists, which is a state certification. Yes, you've heard about that. So it's really bringing this peer approach into, more acceptance as far as like being perceived as a professional field, I guess. We really don't, we're not clinicians. We absolutely understand the importance of clinicians. But our goal as people, I'm a person long-term recovery. So, it's our goal is to pull up alongside of the people that need the services and they're accepted. I'd like to say people don't feel that judgment or that stigma that oftentimes people, stigma keeps people out of treatment because they don't want to deal with that. They don't want to go. So when you don't feel that judgment and crush, why? Because we've all been there. Who are we to pass judgment? We get a lot of comments on that. People will talk about that. Again, it's like any period of transition. I mean, they literally write programs around transition, how susceptible and how dangerous it is for people when they come out of prison or they come out of jail or they come out of treatment. I mean, it's just there's that period of time where there's that gap. And having worked in that field, I know that reentry can happen several times. You can be sentenced to prison, come out, and go to the halfway house or go to the correctional facility. Go back out in the community, not follow the rules, go back to halfway, go back to prison, go back. I mean, so reentry happens at several different points, I guess. So one of the things about Crush that I really, really appreciate having, again, is being able to witness this for a long period of time is, and I like to say this, it's like we meet people where they're at, we don't leave them there. So if we're to get, I'm going to wind up, I'm way off my, I don't always do this, but I don't know my format here. If we're able to, be engaging, build those relationships, it's like, so if somebody's in there for 30 days, 60 days, 90, 180 days, which sometimes I think happens, particularly like if it's a probation control thing, people do that amount of time and they build that relationship. When they come out, they have those services available and they have somebody that they trust. It has been really, really effective. We use a process called 5CRM. We work with the state of Iowa. Of course, we collect all of our data and, we have all the charts and graphs to show the number of people we meet with, how, the success rate that it has. So that's that piece of it. What I feel that we can offer to the Johnson County Jail are these things. And we have some flyers up there because it would take me 10 minutes to tell you all the different groups and services that we offer. We'll definitely have peer recovery coaching. They're certified, they're getting more certified. Peer recovery coaches, when they meet with people, we do what they call a WRAP plan. It's a wellness, recovery, and action plan. And when you come into Crush or multiple pathways, we don't adhere to any one approach. It's like when you come into Crush, there's a sign that says, what does recovery look like to you? And how can we support that? And then these peers pull up alongside of the folks with their approach. So when they do the WRAP plan, it's like there's that piece where they're very much involved with that planning because it's empowering. And what I discovered is people are going to be more apt to follow through with something that they designed. So I think that that's powerful. We've been fortunate in working with 6th Judicial District up in Cedar Rapids, and they're in process of starting a Tech to Connect program. It's in the works right now. 7th Judicial District has had great success with this, and basically it's that digital connection where one of their treatment coordinators, community treatment coordinator, will make contact with somebody while they're still in the institution. And 6 months prior before they get out. And this is really early, so if I misstep here, I certainly don't mean to, but so 6 months before they get out, they're screened, they're accepted into the program, they agree to it, and then the referral is made to Crush. And then during that 6 month period of time, we start working with them, with the Tech to Connect platform. Some of what I think is like, if it's going to be something digital, I have no idea what the jail is gonna look like yet, or what the layout will be, but, you know, to have that digital connection, because that's what a lot of people, do. Again, for recovery groups, the things that we're trained in that we can do, we have, of course, we have our basic 12-step groups come in. We work very closely with workforce development. We do an art group. We do a group that's geared for Native Americans. We have what's called the Veterans Community Alliance, where we literally have a veteran peer support specialist on staff that works with the veterans. We do smart recovery, self-management and recovery techniques, I think. So we do a combination of cognitive, behavioral, and all these things. So that's what we could bring those in, including the reentry navigation. Here's what I found out in just particularly the last 3 years. Nobody knows this system better than the people that have gone through it. You know, how to navigate that system. And it's, and my son is, really summarized this well for me. You know, he's a combat veteran, and he said, you know, Dad, he said, nobody gets a combat veteran like a combat veteran. And that made sense to me. It's like, and it makes sense to me as a person in recovery. It's like somebody in recovery is going to really understand where I'm coming from. Somebody that's lost a son to a fentanyl-related overdose is going to understand better. So it's, or yeah, so better. So they help with the housing thing. They're connected when they come out. And this is some of the things that I'm kind of just, I have to use my imagination here a little bit, because again, I don't know how it's going to work out or how it can develop, but I know that we're quite good at adjusting as we're building. I've been building, I talk about the Recovery Community Center, and I jokingly say I've been building this airplane as I've been flying it for 3 years, because we're new. This is a new approach. But right now, you know, it'd be great, you know, to have on-site peer visits and do the recovery groups in there. We work off right now, we're working out of some of the opioid settlement funds. We're working off of a SAMHSA grant. And so there's no charge. When people come into our center, there's no charge. We'll help you find insurance, but you don't have to go through an insurance process. And to help, to help navigate, I mean, I'll talk more about the navigation in a minute, but we also talk, we go in like to the residential facility, and we provide a number of groups. And the folks that are in the center come up to the center. We always say that the opposite of addiction is connection, and to connect with positive people. I didn't do a very good job at paying attention, so I'll try to move through here. But, you know, a lot of what we do now, we coordinate with case managers, mental health, and we help with discharge planning. It just, that really the possibilities are endless here. And the really key piece to this is right here, is that warm handoff. So it's that warm handoff when somebody leaves jail, somebody leaves prison, and they have somebody out there that they can meet with and continue to find that, they continue to have that peer coaching and support to help them find housing. This is a little bit self-serving. I also work with an organization down in Washington called Healing and English River Outfitters. You know, it's a process of being able to help our veterans get to places where they can, decompress and do things. So we work pretty closely. Crush and Hero work pretty closely together. And we track all of our data. You know, we want to prove that this is effective. So we're tracking it, and it's been proven. So we use, I don't know how to say it, but the acronym is SUPRT. I think it's Substance Use Prevention and Recovery Tracking. If not, that's what it's going to be today. You could look that up later. Here's some of the benefits that I would see as the possibility for the jail. We talk a lot about reduced recidivism and relapse rates, and they haven't, that available for the people that we see on a regular basis in our systems, in different systems. I could see that being part of this reentry back in. No matter where you reenter, is going to be smoother. And the transition, I mean, lower supervision rate, workload. It's like I oftentimes said I spent, and I don't mean this in a negative way, it was just kind of the nature of it. I spent about 90% of my time with 10% of my caseload. Because it was just, I worked intensive supervision. So there was that other pocket of people that I really wished I could spend more time with, but I couldn't because I was busy stomping fires out over here. And not that, they're not any more or less important, it was just kind of what needed to be dealt with. I really think that having a go-between, like someone like Crush in a partnership, that collaboration between anything that's correctional and the community. Because we work with parents, we work with families, and we can help share that information and kind of be that bridge there. I really think that we're going to have tangible success. We're going to be able to record stories. I think that that's going to help show the sheriff's office in Johnson County as a whole, the commitment to rehabilitation and, and betterment of the community in general, and just a positive community trust and impact and public perception about the folks that we cross paths with. Here's what I would suggest. And again, it's like together, I think we can do this. If we could have a pilot program, maybe for select pods or individuals, we'll send coaches down. We don't need much space. We'll travel. And we've been doing some of that already, but we'll travel. Maybe if we could have a room to do some of that and to help make those plans, how are you going to get out to get to your evaluation? How can you get connected with any treatment services or medical needs or, things of that nature that, I could see a memorandum of understanding, for a type of service coordination that would make that a little bit clearer. Shared outcome reporting. We love to share our data because we want to show that this works and this is effective. And, the funding alignment, we use some opioid settlement money. We work out of SAMHSA funds and we work through the state opioid response.
What is the SOR on that?
A state opioid response fund.
Oh.
Yeah,
It's a
SOR.
SAMHSA grant.
Yeah, it's a SAMHSA grant that it just kind of trickles down. Thanks, Joyce. Really quick testimonial. I know I'm over here and I apologize for that, but this is one of our outreach counselors in Cedar Rapids. Crush is and continues to grow as a staple in our community. When I refer a patient to Crush, I know they will be greeted with warmth, compassion, and empathy. Crush remains a safe landing spot for those who are struggling with substances or in recovery or touched by addiction. The peer coaches go above and beyond to connect their peers with resources and lasting relationships that will foster growth and a working foundation. So that's one of the ASACs. And then lastly, we have a lot of luck, and I really appreciate this. This is a person that literally came out of jail, and he said, coming from jail and into the halfway house, I didn't think there would be anything out there that would help me put me on track. I thought I was going to struggle and have to do a lot of stuff on my own. I was scared, but then decided to take that step and go to Crush. It has changed everything for me. So that's a current Crush peer. So I apologize for going over, and I apologize for rate of speech being about 120 words a minute. But that was about a 20-minute presentation and about 30-minute presentation. I knew it was going to be a lot. It's been a lifetime of work. I was telling Ron earlier, I said I always get a kick. People say, hey, can you come and do a 15-minute presentation? I'm like, no. No, I just can't. It's like, why not? I said, because I'm an island. It literally takes me 15 minutes to say goodbye. It's like, if they get there, well, wrap this up. We're dedicated, and we have 100 volunteers, and we see 1,800 people. We do a month. We do outreach, and I really think that I would like to be part of this. I'd like to be part of this with Johnson County, and I'd like this to be part of something that happens with Johnson County Jail.
No questions, but I just want to comment that I think in pretty much every area of healthcare and social services, that navigation piece tends to be the missing important piece. Our community has a lot of services available to help folks with a lot of things, but even if it's all handed to you, getting a pile of paperwork like this when you're dealing with difficult life circumstances can feel really impossible for folks. So just want to acknowledge that.
If you have a substance use disorder,
yeah,
you're not fired anyhow. And so to be given all these things, and you're going to wait for months for your brain to start firing, and to get this list of things that you have to do, sometimes it's just impossible.
Ron, are you doing any work in like the Lynn County Jail now or any other jails? Or tell me about your interactions with other jails.
So what we're doing up in Lynn County really comes down to NCIC. We're working in the prisons through Core Links. And we don't get in, well, we do get into the jail in the sense that one of our veteran peer support specialists is, he goes in a professional visit. So if you got to get something signed or like a release signed or something like that, he can go in. But this kind of, I mean, they have some services available. They're faith-based services. So we just haven't, I mean, we've met with them repeatedly and tried to get in. We just haven't had any luck.
They have to put all of our stuff in a kiosk.
Yeah.
And so we get calls and they get free calls to call us
Yeah.
now out of jail. So.
Okay.
Yeah, that's kind of cool. Yeah, that a thing we can explore looking at with the new jail potentially.
Kiosk.
Well, if there's an ability that from the jail, you're saying that they can contact, I'm assuming the jail probably has a select number of places that they're allowing.
They came up
calls for, but
and they've had several meetings with us, and that was one of the things they offered was to be able to have people call from jail up to their peer coach, and it doesn't cost them anything. So it's a nice service.
Cause I know that like with, phone costs can be a challenge for some folks, and we often struggle, like at Inside Out, sometimes we're trying to, maybe reach somebody, and, we have kind of our, Ben is amazing, and we can connect with people sometimes through Ben, but, if there is an opportunity for someone to maybe give us a call saying like, hey, I'm going to be getting out tomorrow or whatever, and we can kind of be prepared, to support them, that would be, really, really beneficial. Cause I know obviously like we're also discussing about like going in the facilities, which is great, but if there's, a way to explore what that could look like, that could be a real benefit for people to be able to.
Yeah, I agree. I don't know if you get letters, but
Yeah.
I get letters from people in jail, and we do try to answer them and send the resources that they're asking for, but there's that time delay. You don't know if they really get it or not, so.
And maybe some of that would be solved with going in the facility. You can just connect with folks so they don't have to make the call. Maybe that kind of resolves some of that, but that's just a kind of an interesting idea that I hadn't quite heard or, thought of. That could be something that could be
When you say NCIC, you mean like the phone service provider, not,
Yeah.
okay.
Yep, I just rattled that off. Yeah.
Yep,
So,
okay.
so I think we actually pay for the calls.
On that we do.
Yeah.
But when they're calling in the jail out, then that's free
That's true. Yeah.
to us.
But
And I think they get 8 minutes. They allotted 8 minutes to them.
Yeah, I think there's some control there on, what.
we do a lot of training. Our peer coaches have all been through, working in correctional settings. It's a specialized training. We also go into the hospitals. We have something set up with the ED department. If somebody comes with substance use disorder, they call a coach, we show up. And so they've gone through a lot of specialized training around all that to know. And it just, I don't know, I just really, obviously I feel strongly about this. It's like taking that jail time, whether it's 30 days, 60 or whatever it might be, if it's contempt or whatever you waited for, it makes it something productive. Where you can have that connection and just, start looking for that approach. I don't know how many times I heard, people say, I can't use Alcoholics Anonymous. I'm an atheist. So, okay, what does work then? Where do we start? Just like, yeah, you heard that one too. And so, I don't know. It's been very new and it's getting a lot of traction, and hopefully we're part of it.
Another key point is Rod and I are both from Johnson County. So we were born here in Iowa City and raised and live in North Liberty. And it would be special for us, I think, to be able to spread our wings back down here. So.
Yeah, and the positive aspect of people meeting somebody before they're out is the more
increased likelihood that they're going to connect with them once they are out and stay in treatment. We're seeing that with the NAMI peers that are going into the hospital over at the university. We're seeing a lot more of them coming to our place drop-in center. So, you know, it's the same kind of thing, same principle. Once they meet somebody and they connect, it makes that transition much safer.
We're actually working with the university, the ARC program. We're working on a grant with them, so.
Great.
Additional discussion, folks?
How long are your SAMHSA grants for? Are they good for a period of time still?
The most recent one that we just got is for 6 years. And the other one, the one we started with was 6 years, and we still have 2 years left on it. And we also have some opioid money. And recently, out of the opioid settlement money, we were allotted money to buy a building for ourselves up in Cedar Rapids. So awesome.
In a van.
In a van. We just found out today that
Yeah.
we got money to buy a van, a crush van. So.
Ron, you mentioned 30 days to connect with an individual from the jail. Is there anything shorter than that? Like if we like contact you and say, or we refer them to you, can it be 5 days, 4 days, 1 day?
Yeah, you know, I think that anything, as long as we can make that warm handoff. So if you have somebody that you know is dealing with a substance use disorder or mental health, and maybe you see them, you know, pretty frequently. It's like, well, it's only 5 days this time, but I know they're gonna be back for 5 more. You make that connection and then, you know, there's no guarantees in any of this, but I can tell you that like with the hospital, it was very, I don't know, it was just what am I looking for as far as like data collection, like research. The folks that we have contact with in the ED follow up with crush at 85%. That's remarkable in the world of substance use disorders to have somebody, you know, follow up, and then we follow up with them as well.
I was gonna say our turnaround time, if we get a call from the ED, we're down there usually within about 45 minutes to the ED. So fairly quickly. So, you know, if we got a call down here, of course, it takes 30 minutes to drive down here, but you know, we could be down, you know, if it works for that day, if we have a peer available, or the next day. I mean, it's not gonna be, you wouldn't have to wait 30 days and have us come down.
No, and I know there's gonna be a lot of development around this, you know, for sure, but I think that in, you know, Lynn County, we've proven ourselves as good partners with other treatment agencies and the people up there, because as I said, we just want to collaborate. So anything, if they're willing, you know, we'll make that trip.
And I kind of mirror what they're saying as well. You're bridging that gap, and that's the biggest piece we're missing here is just that gap. There's a lot of services around, but they're kind of like siloed a little bit. And if you know, and that's a great service you're providing because you're bridging that gap between those for the release or prior to release to those other, I mean, I assume to those, you know, possibly to those other services that are available as well.
Yeah, that's what we hear that all the time in our system of care meetings. And so, you know, I'm glad to hear, Michelle, that you got Ben and that connection, but Ben's one person, and I imagine that there's a lot of need for Bens and that, you know, connecting to the outside.
Anything else, folks? Well, thank you for the presentation. I certainly appreciate it.
Thank you.
All right, next on our agenda this afternoon, future program space needs from the jail staff.
We had just sat down and kind of discussed some of this today based on, you know, what we kind of learned last time, what everybody felt they would need in a facility, and kind of what I'm hearing again today. And when we think about what our count is, what our capacity is, and the needs of everybody, we're in the camp of needing like 2 classrooms, probably I know more than 20 capacity, and then probably 3 like individualized office spaces for those one-on-ones is really to implement into a facility where I think meet not only the needs of today, but for at least the population of what the facility could be if we were at capacity. It's interesting to hear what Scott County what they have when you think about the scale. And what they said they started with 4, they went down to 3, and they have an inmate population of almost 400, and they house out of county. So you got to think too, what they are housing out of county is because they're making room for federal inmates, because they're running it like a business. So they have a cost with housing out of county, but they still are clearing a profit. But you got to think there's a likelihood those inmates that they're housing out of county then aren't having access to the in-house services. And so, we have to think about the same thing here too. Like, even if we were to do something like this now, because of us having to house out of county, we would probably have some that are not able to access these services because they're not housed here. But given what everybody said last week, this meeting, and I'm sure what we'll hear next time, is I think 2 classrooms, 3 individualized meeting rooms will meet what we need and what you all would need to come in and provide some sort of in jail services.
There's one question, I was kind of curious, I thought maybe we should have asked them, is like, how hard is it to schedule that? So they have 2 full-time staff that is doing that entire programming department?
So I think I touched on that last time. I mean, that's really gonna be the big challenge we have on our end, is just the logistics of it.
Yeah.
How are we gonna one reason we need 2 is because we have to think about male-female separation. So it's really gonna be having to start with, probably like a Google Calendar or something just to keep track of it. But, we can't overpromise on what we're going to provide, because unless somebody's going to pony up the money to pay for a scheduler, I mean, at some point, is this a staff position then the county's taking on? So we just things to think about when we're talking about what we're actually going to be able to do in the future too. Yeah.
I wonder if there's a reason that we couldn't use the same just room reservation. Is there a way to grant access to that to people outside of the county? Like community partners to reserve, if we add your rooms to the room reservations, and people can just go in and do that to make sure nothing's overlapping.
We have a policy issue in front of that too, but yeah, no, generally it's internal, and then, yeah.
But that seems like something that could be easily overcome. Whether it is just a Google Calendar, or if there's some other platform that, we'd have to spend a few bucks to acquire.
Maybe. We'll need to talk about it, because we'd also, we're not just opening up and people scheduling a place to have a get together.
Right.
Like, we have to vet the providers, the individuals. And if it changes week to week, we can't just find out on noon on Wednesday that, hey, it's a different person that's coming in tonight for this. Like, it's a different process.
Yeah.
Go ahead.
Brad, I was wondering a little bit about, if we do get a new facility, and the new facility obviates the need for, I know how much time these guys spend figuring out, okay, who's going out and when are they coming back, and when do they have to be back? And if we eliminate some of that scheduling, maybe that would be some time that could be put into scheduling the rooms. Because ideally, that first part would be a part that would go from a very, very big job now to hopefully a small job.
Maybe
Is that fair?
Maybe
to
there's some
say?
sort of a AI tool that could help. I don't know.
Okay, anything else on this item? So 2 classrooms, 3 offices, or smaller meeting spaces.
Yeah, those one-on-ones for you or you folks or Ben or whoever, I think would probably meet our needs without getting, as I keep talking about, there's the dollars per square foot. We always have to remember we're adding these things. So I think that's a reasonable place to be. Think about space, and we're not adding too much more square footage, which means a lot more money every time we say we want to add something.
Okay. Item 3, discuss CJCC next steps. Yesterday morning in our weekly work session, supervisors discussed, we believe that we're getting to the point where the initial big push for this, the reconstitution of this committee, we're getting pretty close to the finish line. We are transitioning now from the discussion about what the new facility might look like into needing to develop the bond language, locate the site, and actually, operationally get the thing built. And so with next month's report from CSSI with the focus group findings and a few more of these presentations like we just heard this afternoon, we think, in the interest of all of your time, that we're getting to a point where we probably want to be thinking, do we want to continue beyond January in this current configuration? And that's going to be an ongoing discussion for the supervisors, but I'd like to invite anybody who's on the committee, anybody who's joined us, anybody online, to think about any suggestions they might have. We would probably go back to the charge that we agreed on back in last October, I think. See if that's still appropriate, if it needs to be updated, if we want to think about the membership. So I would just ask everybody to keep that in mind and funnel any ideas or thoughts that you have to us while we continue that conversation. Supervisors, any of you want to add anything?
So on the bond language and we now have, we talked about a dollar amount that would include enough to purchase property, because before, when we were talking a number, that was assumed that we were going to be working with the city. That number also included some money for affordable housing. I'm still at the point, like on the bond language, I think that I'm struggling with those two things being in the amount that the bond would be set for. To me, I think we definitely want to support and increase, affordable housing stock. At the same time, this is something separate from it. And I think what we're doing here today and what we've been talking about with the people that came in before are some of those services that are public that said, this is what I would need to be able to vote yes for it. I would need to know that there are going to be, certain services that are provided at this space. And so I guess as we think towards developing that bond language, I guess I would like to revisit that idea of conflating those two needs that we have in this county into one vote. I don't know how the rest of you feel on that, but I think that it seems like it might be a cleaner and more direct and more understandable thing that I'm voting on. Like we all have been exposed to this over and over and over again, but most of the voters aren't going to, they all have that opportunity. We want to do a lot of outreach and such, but that's not going to be the reality. So I think that we need to make that bond language just as clear, concise as we can.
I agree, it needs to be clear and concise. I genuinely think that there is a significant number of people in our community who would vote no on a standalone jail that would vote yes if it came with a social investment like housing.
What about the social investment, like some of the programming that we're talking?
I think that'll be helpful also as well, for sure.
You can't bond for that. I don't know if we
Services.
revisit this right now, but I kind of feel like we made some sausage and we should stick with the sausage that we made. If we're gonna revisit it, we probably should.
Yeah,
We should revisit it in a board meeting.
Yeah, and Julie, I'll come to you here in just a moment, but I think the bond language would be something along the lines of 99 million for a 120/140 shell out facility with any proceeds remaining after that to flow, just to give one example, to the housing trust fund or something, so that it is explicit, it's simple, it's easy. Julie.
Hi, Julie Persons, County Auditor. I just want to point out a technical voting thing. You can make your ballot language as long as you want. There's no restrictions. The longer it is, the longer the ballot is. And you guys are putting this on the midterm ballot, which is already going to be extremely crowded. And if we run into a ballot that goes to 2 pages, that is very expensive for the county. It's elections, we pay it, that's the way it is, but voters tend to not like multiple page ballots.
Julie, can you, this far out, can you forecast approximately how much space everything else is going to take?
Yeah. Because some of that will also depend on if there are other measures on their schools, things like that. It's going to be larger than normal because we will have 5 supervisors on there, and so that will basically double the space of just the supervisor box. There's other things that are predictable, you know, but attorney box is always the same size. So there are some things that are predictable, but no, we wouldn't be able to tell you 100% for sure. Just if you look at last year where we had the conservation bond on there, that was a very long bond and it took up a lot of space. We still managed to get it onto a front back ballot, which people are okay with. But if you look at, I think it was the Lone Tree School bond this year, which was an entire column. So if we get hit with one of the 2-page, so basically a front ballot, and people don't like multiple pages.
Yeah, I mean, it's certainly my preference to keep the language as succinct as possible. Bill?
Yeah.
From my marketing experience and also optics,
Mm-hmm.
keeping it just for the jail is going to be easier to sell. I see where Mandy's coming from, but if we add the housing stuff on there, I know people who would vote against that. I think we need to make this a success, get her done. The last one we did was combined with the courthouse, and that turned people off. So I would recommend we just have it just for the jail. If there happens to be extra money, that's one thing, but we need it just for the jail. And be easier to sell when you go to the farmers markets every Saturday.
I appreciate that, but I think that the decision that we came to 3 weeks back or whatnot, to Rod's point about having made the sausage, it was after long deliberation and compromise and discussion, you know, amongst ourselves, amongst this group, amongst the public that we serve. And I know operationally, if we were to go back to that, I think that that would threaten the timeline that we have before us. You know, Brad correctly was lobbying me for months probably to get that question resolved. And I'm afraid that if we try and revisit it, it would just put the whole thing in jeopardy. We do have an agreement from that meeting a few weeks ago, and I'm just afraid that if we go back to it, it would be a mistake.
That's fair. That's just my 2 cents.
I appreciate that.
One thing I'll add about the cost, and I think you're right, I think the rest of this is probably better suited for a board work session, but when we did our space study, the concept that we came up with that's on the website was 101,000 and 101.3 thousand or something square feet. And that was with 1 large classroom and 1 small office space. We're now, because what we're talking about, I mean, we are going to add square footage that is going to increase the cost. And that concept we had done almost 2 years ago now was 80 million. This will add more money to it. And so that is going to eat into that. You're talking about up to 99. And so before we do any of that, we have to get whatever the process is or path we have for if it's a construction manager or how that works, that is key to where we go from here. And what we are talking about, are we going to continue, who's going to do that design piece so we have what we're going for with the show to the public. Those are 2 key things we have to get to very, very soon.
Anything additional? Okay, well, thank you everyone for your time this afternoon. It's always appreciated. The next meeting of CJCC is December 11th, 3:30. Until then, be well and we are adjourned.
Yes.